Good morning. In this video, we learn the section through the upper part of the PONS. Upper part of the PONS section. So the section through the upper part of the PONS is taken at the level of trigeminal nucleus. First, we should know the section through the upper part of the PONS is taken at the level of trigeminal nucleus. As you know, the ventral aspect of the PONS, and this is the ventral part of the PONS. This is the dorsal aspect of the PONS. So the dorsal aspect of the PONS is bounded on either side by the superior cerebellar peduncle. So this is the superior cerebellar peduncle, and it is bounded on its posterior aspect, it is a dorsal aspect, by the superior medullary velum. This is bounded on its dorsal aspect by the superior medullary velum. The superior medullary velum is lying posterior to that of the cavity, which is behind the PONS. So which is the cavity behind the PONS? This is the fourth ventricle. So this is the superior medullary velum. So the roof is formed by the superior medullary velum, and the dorsolateral aspect is bounded by the superior cerebellar peduncle. First, we'll see the common ventral features. Okay, ventrally, it is same as that of the section at the lower part of the PONS. So, what all things we saw in the section at the lower part of the PONS? We saw the pontine nucleus, which is scattered throughout. These are the bundles of longitudinal fibers which will form the corticonuclear and the corticospinal tracts. So, this is the corticonuclear and corticospinal tracts. Then we had multiple transverse fibers which will be forming the middle cerebellar peduncle. These are the transverse fibers which will be crossing, most of the fibers will be crossing to the opposite side, and also it contains the longitudinal fibers which are corticopontine fibers. Next, we will go into so these are the features of the ventral aspect, ventral part of the PONS. When we go to the dorsal aspect, which is the tegmental part, this is the basilar part. This ventral part can be otherwise called basilar part. So the dorsal part can be otherwise called as tegmental part. Now if you see this tegmental part, there are some common features. So what are the common features? They are the lemniscus, the medial lemniscus, the trigeminal lemniscus, the spinal lemniscus, and at last the lateral lemniscus. So just over the lateral lemniscus, we have the superior olivary nucleus. Have the superior olivary nucleus. This is the superior olivary nucleus. This superior olivary nucleus is less prominent when compared to the section taken at the lower part of the pons. And this lateral lemniscus is very much conspicuous. It is nicely seen in the section taken at the upper part of the pons than at the lower part of the pons. So similar way we have it on either side. So the trigeminal medial lemniscus, the trigeminal lemniscus, the spinal lemniscus, and the lateral lemniscus, along with superior olivary nucleus. Now, when we go to the midline along the dorsal aspect, from medial to lateral, we have the descending tracts and the medial longitudinal bundle. So, it is arranged in the order medially. We have the medial longitudinal bundle on either side. Then we have the two tracts, the tectospinal and the rubrospinal tract. The tectospinal and the rubrospinal tract. So this is the medial longitudinal fasciculus, tectospinal tract and rubrospinal tract. This is the This is the medial longitudinal fasciculus, tectospinal tract and the rubrospinal tract. It can be represented, it can be easily remembered as MTR. Can be remembered easily as MTR. And the important thing we have to remember about the section which is taken at the upper part of the pons is we won't see the cranial nerve nucleus of abducens, facial and vestibulocochlear nerve. We'll be seeing only the nucleus of the trigeminal nerve. So for trigeminal nerve, we have two sets of nucleus, that is the motor and the sensory nucleus of the trigeminal nerve. So it is arranged like this. We have the motor and the trigeminal nucleus, the motor and the sensory nucleus of the trigeminal nerve. Medially we have the motor nucleus and laterally we have the sensory nucleus of trigeminal nerve. So both are present anteromedial to the superior cerebellar peduncle, and inside the substance of the superior cerebellar peduncle at its lower region, at this region, we have a tract. That is the ventral spinocerebellar tract. This tract is nothing but the ventral spinocerebellar tract. So these are the features of the section of the pons at the upper level. So next we'll study about the blood supply of pons. So blood supply of pons. So the pons is mainly supplied by the branches arising from the basilar artery. So this is the pons and this is the medulla. So basilar artery, as you know, it is present in the sulcus, present in the anterior midline of the pons. So this is the basilar artery. This basilar artery is formed by the union of the two vertebral arteries. So the two vertebral arteries unite to form the basilar artery at the lower limit of the pons. This basilar artery will supply the entire pons by giving so many lateral branches. So these lateral branches are called the pontine arteries. These are called the pontine arteries. And one larger branch which will be at the base of the pons is called as anterior inferior cerebellar artery. So this branch is called the anterior inferior cerebellar artery. This is the anterior inferior cerebellar artery, and these are all the pontine arteries. So what is this? This is the basilar artery, and these two are the vertebral artery. So this is the blood supply of the pons. So the blood supply of the pons is mainly through the pontine arteries and through the anterior inferior cerebellar artery. So all are branches of the basilar artery, and this basilar artery is formed by the union of two vertebral arteries. Thank you.